Welcome to a proposal for a transformation, a change that will bring about growth, value, and better care. This is a transformation to use technology to allow Carondelet Health Network to grow, to expand, and to care for more patients. Already known for their outstanding people and their even better and more outstanding care, this transformation will make Carondelet known for their technology, their process, and their innovation. Carondelet will also be known for their growth and the following expansion and what that commitment means to the communities of Southern Arizona. This project is a team effort of Carondelet and the Arizona State University's W.P. Carey School of Business Master of Science and Information Management program. Today, you will hear from my team, Tom, Scott, Andrea, who happens to work for Carondelet, and myself. My name is Keith. We're going to talk about how technology can enable Carondelet to provide the great care and the outstanding service they already provide in the Tucson area to even more patients throughout all of Southern Arizona. Technology that can be used to create process that is second to none, and technology that makes a patient experiences that matches the outstanding care they already receive. We can't talk about transforming without knowing where we are now and where we are going. So we are going to review Carondelet. We are going to look at their competition, and we will use Porter's 5 forces to summarize. Then we need to look at the market using a pestle analysis. We have to take a look at Carondelet's value chain. Then the transformation begins. We are focusing on patient scheduling, one of the most frustrating experiences for patients in healthcare for our transformation. All of us have spent time in a doctor's waiting room, and we are going to try to minimize that and turn that around and make it a positive experience. We will look at what we do now and how we will provide that change for the future. We have to be able to measure our success, so we provide a scorecard to do just that. Finally, we will look at Carondelet's strategy and the impact that this transformation will have on that. But first, a word from the boss, from the CEO himself.
It's completely true. I believe every word of it. I have the smallest job in the hospital. People walk in the hospital. They don't ask to see our licenses. They don't want to see our resumes. They just come in there and they trust us. And that's a responsibility and a burden that really I think is unequaled. And every one of our nurses, doctors, unit clerks, pharmacists, they are St. Joseph's. They are the ones who determine what experience our patients are going to have, our family members are going to have, the care that they're going to have. They feel that every minute of every day. And I'm so honored, really, I'm honored just to be a small part of that. It's completely true. I believe every word of it. I have the smallest job in the hospital. People walk in the hospital. They don't ask to see our licenses. They don't want to see our resumes. They just come in there and they trust us. And that's a responsibility and a burden that really I think is unequaled. And every one of our nurses, doctors, unit clerks, pharmacists, they are St. Joseph's. They are the ones who determine what experience our patients are going to have, our family members are going to have, the care that they're going to have. They feel that every minute of every day. And I'm so honored, really, I'm honored just to be a small part of that.
Carondelet has a vision of healthcare that works, healthcare that is safe, healthcare that leaves no one behind. Carondelet Health Network also happens to be one of the largest employers in Southern Arizona, and it is actually the oldest healthcare provider in the state of Arizona. In fact, St. Mary's Hospital was founded in Tucson in 1880. This historical tie to the state makes Carondelet very attractive for growth and future development value. Carondelet operates a wide variety of clinics and specialty medical services, such as Carondelet Neurological Institute and the Carondelet Health and Vascular Institute. Carondelet also owns and operates 3 major hospitals, 2 in the Metro Tucson area and 1 in Nogales, Arizona. For a healthcare organization, Carondelet is an attractive organization since they are large enough to benefit greatly from a technology transformation, yet they are small enough to roll out such a transformation very quickly and very effectively. Another benefit Carondelet has is the potential for growth and expansion in southern Arizona. Markets such as Sierra Vista and Safford hold untapped value for Carondelet. The value added from a technology transformation will greatly increase their ability to grow and for Carondelet to realize their vision of leaving no one behind.
Key industry competitors to Carondelet Health Network are UMC, TMC, and Northwest and Oro Valley Hospital. Carondelet Health Network is a religious as well as not-for-profit organization and employs about 4,000 associates spread between 3 hospitals, St. Mary's, St. Joe's, and Holy Cross, with 900 beds. UMC and TMC are also not-for-profit and employ 3,000 associates each, with number of beds between 400 and 500. The Northwest and Oro Valley are for-profit organizations which together they employ 1,600 associates and about 400 beds. Porter's 5 forces summary for the healthcare industry. The barriers to entry is very unattractive. There's a high capital needed to open a hospital, and there's a lot of government regulations. Bargaining power of buyers is also unattractive. The consumers are considered our buyers, and when it comes to their need for services, they're left short on buying choices, as selection for hospitals and insurance providers are limited. Switching costs have little influence on buyers' choices for their medical treatment. Threat of substitute is moderate. Companies with technology innovations applicable to the healthcare market must analyze the market segment and assess the potential for growth in that particular area of the healthcare industry, such as neurological surgeries, which will then determine the organization's profitability and success in the industry. Bargaining power of suppliers is very attractive. Suppliers in rural areas own the majority of the market, and switching costs for healthcare organizations will be high. Healthcare suppliers are physicians, pharmaceutical organizations, and medical suppliers. Rivalry among competitors is very attractive. With few rival hospitals, trade secrets will be easily found through workers, thus establishing differentiation in the healthcare industry will lead to patient loyalty. Pestle analysis summary for the healthcare industry. The forces are political, economical, social, technological, ecological, and legal. Political positive will be deregulation of the healthcare industry will allow for new methods to provide healthcare coverage. The negative is current impact by politicians and the affordability, which have created obstacles in the industry. Economic positive, the personalized healthcare decisions will drive other services to profit. The negative is the monopolization of the industry drove the industry to high costs. A social positive will have the ability to make individualized decisions on the type of healthcare coverage. A negative is the growing number of the aging population, which will impact the healthcare costs. The technological positive is faster and easier access to patients' records through electronic medical record keeping. A negative is laws such as HIPAA have created stringent regulations on transmittal of patients' information. Ecological positive efficiencies will and reduce waste, which benefits the bottom line. A negative are the organizations which need to meet environmental disposal guidelines and can be costly. A positive for the legal will be fewer regulations that are needed for the consumer to make lifestyle decision choices. And negative will be new regulations will occur because of the new technologies.
Thank you, Andrea. My name is Scott. We'll be discussing the value chain and key process aspects of Carondelet Health Network's technology transformation. Carondelet Health Network sets the standard for healthcare amongst other rival providers in the southern Arizona region. The primary activities of Carondelet Health Network's value chain provides the foundation that enables this organization to deliver top-notch care. Key primary activities involve inbound logistics, which touches medical history and data, operations, which includes facilities, scheduling, and laboratories, outbound logistics, which touches discharge, medical history, follow-up, and billing, marketing and sales, and service, which culminates in experience entrusted by those who seek care from Carondelet Health Network. The current state scheduling process at Carondelet Health Network is characterized as suboptimal. This graphic represented on the slide serves to highlight the disparate and silo nature of scheduling across functional areas and activities. This includes admissions, hospitals, doctors, and discharge. This deters cohesive communication and robs Carondelet Health Network staffs of efficiency, which negatively impacts processes and stakeholders throughout the value chain. Technology transformation serves to resolve the siloed business practices discussed on the previous slide. The future state graph depicts each activity fully integrated and connected with each other via scheduling. Through integration of key enterprise resource planning technologies, scheduling will be enhanced to improve collaboration and connect functional areas and activities and customers as never experienced before at Carondelet Health Network. The result will dramatically improve operational effectiveness throughout the value chain and improve customer experience. This concludes my portion. Next will be Tom Willis discussing Carondelet Health Network strategy.
Thanks, Scott. Hi, I'm Tom, and I'm pleased to discuss the impact this transformation will have at Carondelet and how we are going to measure its success. Let's highlight some of the main focuses within Carondelet's strategy. Carondelet will become the leader in healthcare in Southern Arizona. That is powerful, and we can accomplish this by implementing and acting on our strategy. The first focus of our strategy is to maximize efficiency by leveraging technology. Not only does this reduce costs, but with the technology transformation and scheduling, it will also increase revenue. Extend the best patient experience through our technology transformation. This transformation has to center around the patient and make the entire scheduling experience much faster, easier to understand, and less frustrating. Improving this for patients will mean we have invested in them, in ourselves, and in our business process. This will make us more cost-effective, more efficient, and allow us to serve more patients and families. Yes, we are one of the leaders in Southern Arizona, but we are going to be the leader in Southern Arizona. Now I am going to share how that is going to impact our competitive standing. When our scheduling transformation is finished, we will have created a one-of-a-kind experience for our patients, employees, and doctors. This experience will not be easy to imitate. Thanks to Carondelet's presence already in Southern Arizona, this innovative and efficient experience will attract more patients. Not only will we attract more patients, but we will retain more patients because the process to be a patient with Carondelet is simple. And while we are attracting new patients and repeat patients, we will also be maximizing the utility of our facilities, ensuring quality care to patients, as well as generating profits for Carondelet. Finally, I would like to discuss the success metrics that will let us know if the transformation is working as intended. Financials measures include amount of time schedulers are spending with manual tasks, tracking increase in revenues, which should be seen thanks to increase in patients, payments received within 30 days of patient discharge, and higher HCA-HPS scores. Customer measures include feedback in particular to the scheduling process and the satisfaction with scheduling of urgent but non-emergency procedures. Learning and growth measures include the number of health providers and patients making use of the new scheduling technology, and internal measures will include number of incoming calls to schedule appointments, staff hours spent on scheduling tasks, accuracy of ICD-9 codes, and completeness of required patient information and data.
Thanks for your time. This concludes our technology transformation proposal. So be well.